Thank you. Measure 110 is, there are a couple of titles, but I don't like the word addiction personally. I feel like it loses a lot. There's a lot more to it, but it is the drug addiction recovery and treatment program, basically. Measure 110 was passed at the same time Measure 109 was, and part of it acted to decriminalize all substances in small quantities in the state, which, instead of now being a felony or a misdemeanor arrest, people get what's called a Class E violation. And that's a $40 fine essentially, but you can have that fine waived if you receive screening. And all it requires is a screening for substance use disorder. If you screen and you screen positive, then you could, if you chose, enter into services. And if you chose not to, then the fine is still waived. So that's the first part. The other part is we're building a program statewide. The program is creating what are called BERNs, Behavioral Health Resource Networks, in each county and for each tribal nation. Substance use disorder treatment, harm reduction services, peer support, housing, and supported employment services for folks who are struggling with substance use that is disharmonious. All of these organizations, we had 333 different entities across the state apply for grant funding. We have about $265 million that have been granted to us to grant to the state. And we have a council of 21 people who are all, most of them are folks who have lived experience of recovery. They now all work in various aspects of recovery processes. A lot of peers. We have a physician who works in substance use treatment. We have a bunch of different folks from all over the state providing community input to make this program happen. They built the rules that govern the program. They built the grants process, and now they are actually awarding the funds. So this is a huge change from the way that the state usually does it. Normally, it's a small group of OHA staff who build rules, build grant processes, seek input through a rules advisory committee, similar to the way Measure 109 did. But in this instance, it's all community making all the decisions. So it's pretty cool. I think it's a big change from the way that state government happens. It's bringing a lot more community voices and input to the work of healing the community, and I'm really excited about it. I'm very, very happy and very proud to be a part. But that's 110, and I know that you all are here to hear more about 109. So I think probably the most pressing matter would be the question of the chair. So I'll start there. I believe it was March 11th, we received notice from Tom Eckert that he was choosing to resign as the chair and entirely from the Psilocybin Board. So we have a system set up on the Psilocybin Board of one chair and two vice chairs. And so Athira Boss and I are the vice chairs. And for this past March meeting and the April meeting, we are taking the role of chair for the board. However, in April, we have elections. So the end of this month at the meeting of the Psilocybin Advisory Board, so April 27th from 1 to 4, the Psilocybin Advisory Board will be meeting in part to vote for new chair and vice chair roles. Tom held the role for nearly a year, and Athira and I have been in the vice chair roles for almost a year. So at the April meeting, we will, I believe we're going to be nominating and voting for new positions. We also may be voting for new subcommittee chairs as well. But we're leaving that up to the board for discussion, because essentially at this point, the majority of the recommendation work from the subcommittees is done. We have had several rules advisory committees at this point, and the rules are now well on their way to being finalized. Not all, we still have some rules to work on. There's still quite a few subcommittee recommendations that we still need to move forward, and we will be voting on those as well, starting in the April meeting and then moving into the May and I think possibly the June meetings. So basically we have 3 meetings left to vote through all of the recommendations from the subcommittees. And the list is quite extensive for those recommendations. We have a lot from licensing. We have, I think we still have a few training recommendations, but I can't remember. We definitely have equity subcommittee recommendations. We'll be working through those over the next few meetings, voting to approve and potentially modify some of the recommendations depending on what the full board decides is going to be most relevant for the work. And I wish that I had a list, but the agenda is not out yet. I think it will be out pretty soon, and it should be posted to the website once that is ready. So at the April meeting, we'll have the voting for new leadership. We will have a lot of voting for recommendations. Most of them, I think, for this meeting are licensing and maybe a few stragglers from training and potentially a couple from equity. But I think that the majority of the equity subcommittee recommendations will be in May, and we'll have more licensing recommendations in May as well. So I'll pause there and see. I know that was just sort of a brief overview of where we're at right now. Are there any questions? Yes, John, hi.
Hey, Angela, nice to see you.
You too.
So I was looking over the agenda for the meeting on the 27th, and I noticed, as I don't know how involved you were with the licensing subcommittee's recommendations, but
Oh, is it
they had
already up?
it is,
Oh,
yeah.
thank you. That's great.
And they had made 2 different recommendations with respect to the facilitator to client ratio. And I've been concerned about that ratio because that will be one of the largest factors in how expensive services are under the measure. So initially, the committee had voted in way back in August of last year to a 3-to-1 ratio. And then after the talk of microdosing had kind of taken off, and after some talk about religious use had taken off, the committee had revisited that and come up with a separate recommendation in the January 6th of 8-to-1 for regular or perceptual doses, and 10-to-1 for like microdoses. I just would flag that the later of those 2 ratios or recommendations that licensing made on that reflected more consideration after the issues had been developed kind of through the public and through more consideration. So I guess it's not so much a question, but I just wanted to flag that one of those had the benefit of additional kind of input and consideration. And I thought it was interesting that they both appeared on the agenda.
I think that microdosing, or what the board is calling subperceptual dosing, is going to be a pretty hot topic of conversation. There's been a lot of discussion of it and a decent amount of back and forth around things like the number of folks per facilitator and what the cutoff dose is for microdosing. I mean, that's the term that we use in community. OHA wants to use subperceptual dosing, but there's so much variation in the way that everybody's body reacts to different doses. And then there's the factor of, every single mushroom, even if they're right next to each other, can have a completely different amount of psilocybin per dose or per quantity. So it makes it a little bit difficult to draw those clear boundaries between what subperceptual is and full dose would be. And so there's been a lot of concern about how that's going to land. Microdosing is super beneficial for a lot of folks. I mean, just sort of on a large scale in the public eye, Paul Stamets has his protocol of dosing with hericium and niacin. Like there's all of these different microdosing protocols, and a lot of folks do find it very effective for managing mental health concerns, for maintaining well-being, for having a connection with the fungus. So I know that that's going to be a big debate, a big discussion. And yeah, I really don't have a sense of where it's going to fall. My hope is that it can be something that is available to people and available in a way that doesn't require them to sit 8 hours at a service center. But I don't know how that's going to land. I don't know how that's going to turn out. If the psilocybin is in a pill and you know that there is an exact amount, then it is a little easier to regulate, but that's not necessarily sort of the ethos and the heart of the reasoning for microdosing. Yeah, I mean, I thank you for bringing it up. It's a hot topic. It's something that's going to take some time to work through. I know that there are some folks who don't want to draw that line. And then there are several other folks who feel very strongly that that should definitely be part of the program. Yeah, I'd say tune in to that meeting and see what happens. I'm looking now at the agenda. All right, let's take a look at the recommendations. So we have a decent number of recommendations around facilities and what those service centers are going to look like. Some around safety, some around inspection, some around what kind of building they can operate out of, specific licensing of certain centers, what kind of endorsements may be possible to lower licensing fees for manufacturers. Then there's a decent number of recommendations around client privacy. A couple of recommendations on not using audio, photo, or video surveillance in the facilities, not using anything like ID scanners or facial recognition or other metrics for identifying people and storing that identity long term. I think the main goal of all of that is to prevent folks who access psilocybin services from having any issue with federal regulations. And then there's the discussion about the group administration and the number of clients to facilitators, the ratios. I think that the overall goal of the licensing subcommittee was to try and keep things low cost for folks, but a ratio of 8-to-1 for perceptual doses and 10-to-1 for subperceptual doses is where I believe they've landed at this point. And it's a recommendation. It is being presented to the board. There will probably be a decent amount of dickering that happens with those numbers. I know that there are a lot of people who want a much lower ratio, more facilitators to clients for perceptual doses. I know that a lot of our board are very focused on safety and really want to guarantee safety. And there are other folks who, I think safety is key for everybody for sure, but where that safety line lies is complex. We have some standards from some organizations, a lot of organizations that do group work or research do a 3 to 5 to 1 ratio. And that seems to be a number that works relatively well for them. Going up to 8, one facilitator for 8 clients who have perceptual level doses. I mean, I can say personally that trying to work with 8 different people who are all experiencing a really intense journey and may need various different aspects of support during that experience, I would have a hard time managing that personally. Just, being able to have the one-on-one connection with somebody, if they are having a traumatic experience, being able to connect with them in the moment and support them while still maintaining all of the other people's support and safety in the room, that's an intense task. Those numbers probably will fluctuate, but that's where they're currently set from the recommendation from the licensing subcommittee. Allowing group administration sessions without limiting the total number of clients in a group, as long as it complies with building occupancy and other requirements. So that would potentially allow for large groups, as many people as can fit legally in a building safely. And again, depending on that ratio decision, could be, if there was a group of 50, let's do 40 because that's easier math. That would be 5 facilitators for 40 clients. So that's up for question. They're also looking at voting for group preparation sessions so that, again, costs can be kept low. Remote preparation sessions so that folks can do one-on-one over Zoom or some other platform similar to that. And then also the option of group integration sessions. So if, for instance, a group of people have had a session together and done some process work together, they would be able to come together and continue that process in the integration session that is required. That's just a sort of a smattering. That's not all of them. Then there's some discussion that will happen around staffing, number of staff, who's going to be on call, what on call means. And then there's a requirement of presence of the facilitator in the room for monitoring the process, with the exception of bathroom breaks or snacks. But basically, facilitators would need to either take those breaks when someone is feeling in a safe place or find someone to spot them during those breaks. There's also some discussion coming up about outdoor administrative sessions. Basically, I think the goal is to allow as much outdoor access as possible within the confines of having to be attached to a center of some kind. And I don't know if we have a discussion of distance from the center or if it needs to be fenced or not. Yeah, I don't know. I don't think that particular aspect came up for discussion, whether or not there has to be an enclosure around the space that's outside. In my ideal world, outside is, I would prefer always to be outside. I'm here, I am outside. And I personally feel like, for me and for many people that I've spoken to, being outside is a really big, important piece of the connection to the medicine, to the fungus. So I think that is an important question. How far away from a service center is considered to still be at that service center, and what kind of enclosure needs to be present. So I will probably bring that up at the board meeting for discussion. And then there's some discussion further of advertising. There's actually quite a bit of discussion of advertising and how products and service centers can be advertised. No targeting advertising outside of the state of Oregon, not using web tracking technologies. I think a lot of the recommendations are around privacy in general, just making sure that folks who are accessing services can access them safely, not just in the physical and emotional sense, but in the legal sense as well. We have so much to get through. My goodness. No third-party internet cookies will be allowed. There's also a section on how psilocybin products are going to be labeled and packaged up to ensure that the psilocybin maintains its potency. Also, it lists what it contains so that folks know what they're taking, what they're putting in their body, expiration dates, specifications around all of the details are what are included. And then there's a section again on the process of licensing. There has to be access to emergency services at service centers, service center inspection regulations. And then there was an interesting discussion. I know that, so OHA unfortunately has relatively limited staffing. And because of that, there are a lot of things that OHA will struggle to be able to accomplish. And so there are some recommendations around the licensing subcommittee itself helping with some of the tasks like regulation and monitoring of basically oversight of licensing and licensing requirements. And then we have our equity plans requiring that licensees would create and maintain an equity plan, a social equity plan. Essentially, how are you going to make sure that the work that you are doing takes into thought and supports the community, and especially folks who have been marginalized, specifically by the war on drugs? You know, how will service centers and licensees create more jobs, and how will they direct those jobs?
So this is the set break.
Are there any questions for John Dennis from anybody out there?
John, maybe take a moment and restate what you're working on.
Yeah, thanks, Kesri. Yeah, so we've started an organization called the Theogenic Practitioners Council of Oregon, kind of rose out of kind of a group of us who've been following the Oregon Psilocybin Advisory Board's rulemaking process. And we've kind of been working to ensure that the program creates some community-led, community-supported pathways to take psilocybin under the program in a kind of a more horizontal model that could allow religious activity and kind of just spiritual activity in a community container that kind of is intended to empower communities and allow them to grow their own kind of mushrooms on site and give them some flexibility with how they do that, and kind of just create a more horizontal community model within Measure 109 so that it can be more affordable and there can be not a whole lot of, that we could leave as much money out of the system as possible. One of the benefits of community is that community pools resources. And that means that if somebody doesn't have money necessarily, a more community exchange model could allow something other currency other than money to be exchanged in order to participate and that sort of thing. So we're trying to kind of make this more of a grassroots or democratized kind of program that would be something that people such as members of this group would want to perhaps use more often than they would if this is a $2,000 or more system where it's just really outrageously expensive.
I just want to piggyback on John and say that I really support the entheogenic practitioners licensure. I'm very excited for it to come to a vote, but I believe the vote for that one is not until May. So that means that we have a little bit of time to talk to community and rally support for that particular measure. I belong to a church that uses psilocybin as a sacrament, and I want my church to be able to be out in the open and not have concern for arrest or, long-term negative impacts because of the sacred rituals that we take part in. And so this is a really important piece to me. It's a spiritual practice, and I believe that it should be open and available to people who want to commune with the fungus and with each other in that particular setting. There's a lot of potential for spiritual growth, community growth, connection, healing of community hurts through the use of psilocybin as a group. And, in a spiritual setting, it's a very different experience than in a clinical setting, for instance, or, even in a service center. My church, we are outside. We are outside. And that is, in my opinion, the best place to be for spiritual connection. And so I'm very excited for this vote to come up, and I just want to express my support for the idea and hope that all of you can voice your interest if you have interest as well. And again, this is my opinion, but I can't speak for the board.
I appreciate that, and I'm really glad that you were able to show your support. I put the links to the petition and to the Oregon NPO group. I guess now that you're all settled inside, downshift back into what we've been doing.
Whee! Okay, I think I was at the social equity plan. The goal is to get folks to basically think about their community, how the business will impact the community, and how they could build business in a way that is the most supportive of community. I'm very excited about that. The goal with that, again, is to make sure that diversity, equity, and inclusion is really thought through in both internal practices and policies and the programming that's built, and also in the way that the programming is offered to community. Would also require basically a report with information about how the process is going with the social equity plan, so that they can continually improve on that plan, get feedback on the plan, and if they're not able to stick with the plan that they've laid out, if they're not able to fulfill essentially their social equity mission, then they could be put on an improvement plan with the state to increase equity and increase inclusion practices, or their license could potentially be terminated if they continue to not fulfill the outline that they would set for themselves. I feel also very good about this plan. This is, when we look at specifically mental health and the populations that are most impacted, it's folks who are impoverished, it's folks who face marginalization because of their role in our culture. Maybe they are a person of color, and people of color have historically been marginalized, or maybe they're a queer person or a trans person, and the burden of the majority of mental health concerns that can be well managed with psilocybin is on folks who have experienced the most trauma and the most marginalization. So yeah, I feel pretty good about that. There's also requirements for things like more continuing education, specifically around equity and racial justice. And there will be some discussion about what kind of continuing education will be necessitated as part of facilitator renewals, and what needs to be done to maintain licensure. The next level of discussion is around compliance. So compliance meaning how the licensees of facilitators, service centers, manufacturers comply with state law, and what sort of penalties there may be if they are not able to maintain that. Mostly, again, it's around safety and just preventing folks from doing harm. And then that, I believe, is the end of the recommendations that we're working with this month. It's a long list. Thanks for listening. I know that was a lot. Is there anybody who has any questions or at this point discussion that you all would like to have? I'm here in part to share information, but also to take your thoughts back to the discussion with the board and try and integrate what community wants and needs in this process into what we do.
There we go. That's awesome. Allison has raised her hand. We'll let her go next. And Allison.
Hi, Angela. Thank you so much for being here. I have so much honor and respect and admiration for the work you're doing on both 110 and 109. And I just really appreciate you taking the time to come share with our community. I know you talked a lot about the equity subcommittee and the recommendation to make sure every facilitation center is making an effort to meet equitable needs. I just shared a link in the chat that is to an article that was written by Psychedelic Spotlight about how all of these rules and regulations are going to basically have a negative impact on the consumer and how that will negatively impact lower income communities and the inaccessibility of that. And I'm wondering, is the subcommittee's recommendation trying to mitigate that, or is OHA just kind of accepting the fact that this will be inaccessible and living with that for now and kind of doing our best to just reach like the middle class folks for group sessions and things like that?
It's a really good question. Yeah, it's a really good point that the more layers of bureaucracy that are present, the more that increases potentially the cost. I know that OHA is working as hard as they can to keep the costs for licensing as low as possible to sort of minimize the need to then charge higher fees for folks coming to the sessions. And, I still have my long-term goal and vision to get this to be something that in some way could be covered by health insurance. Again, because this is what we have right now. We have health insurance covering mental health. And so, psilocybin services for spiritual purposes, psilocybin services for personal growth probably would not be covered with insurance, at least at the onset of things. But insurance is an option that could potentially be utilized to reduce cost. I think I've talked about this before at length, but if folks could, and if OHA were to agree that, for instance, a peer support specialist certified, licensed by Oregon to provide peer support services and billable to insurance, including Medicaid, if a peer support specialist were to be dual licensed as a facilitator, and they could then bill the client's insurance for their services, not necessarily for the actual psilocybin itself, that's not going to get covered for a while, but the services, the sitting with, the support, and possibly some of the other pieces might be something that could be covered by insurance. So that is one option, but that's more of kind of a long-term goal. It's not likely something that's going to happen with the first iteration of this process. At the moment, considering that the facilitators will need to have a living wage and the service centers will need to take some money to maintain their operations, and then there's the licensing fees and the testing fees and all of the other pieces that go into this process, it's likely that it's going to be, at least for now, on the middle class end of things, with the hope that community can come up with some ways to facilitate folks who are lower income receiving scholarships, offsetting the costs by having a sliding scale situation. People with higher incomes pay a higher level. People with lower incomes then are subsidized by that. There are some training facilities that are likely going to ask their trained facilitators to honor a certain code of providing some facilitation to the community at low or no cost. Again, sort of a not so much a sliding scale, but a scale for, in the sense of equity, providing services to those who wouldn't be able to access them otherwise.
Mhm.
It is a good point, and it is true that services will probably be outside of the reach for folks who are at or below the federal poverty level.
Yeah.
And I feel sad about that because, I mean, that's again where the majority of the trauma is. That's again where the large portion of the mental health concerns are. And so getting services to folks who are lower income is really an essential piece of, I think, the work that I'm trying to do. This is a healing modality that has a lot of potential, and I want it to get to the people who need it most. And I still feel hopeful because, this is just the beginning, but I do believe that in the beginning, it's going to be a certain subset of folks who are able to access it and a lot of folks who may not be able to.
Yeah.
So
Thank you for your just speaking to the truth of that and transparent about that. I know I've heard you speak several times on this platform, and I know genuinely where your heart and soul is. And so I just really appreciate you staying in such a strong leadership role to try to see this through in a proud way. And also just to kind of reassess, so that subcommittee's recommendation of every facilitation center to have some sort of, so a sliding scale fee would count, a scholarship opportunity would count, all of those things would kind of count as meeting the needs of an equity approach.
yeah, and I'm sure that folks will come up with a lot of innovation around how they can do that. Sliding scale and scholarships are just a couple of ways. There may be other options too. Maybe people could set up work trade. Maybe people could, I mean, there's a lot of possibilities for how we could find ways to get these services to folks who need them most. And I hope to see on the equity plans that come through a lot of great ideas that we can then, take and maybe build sort of a best practices model for moving forward. These are some ways that you can be the most supportive to your community. But at this point, yeah, we're not there yet. Hopefully we will get there. It's disappointing that we can't from the outset build this program so that it is openly accessible to everybody. And also it's the system that we're in, the economic system that we're in. People have to make money. This is the system that we live in and we have to work with. And it is an unbalanced system in a lot of ways. And it's part work in the little world of psilocybin, but it's also part work on a larger scale of changing the paradigm around how we interact with each other and do business with each other and care for each other, and how we integrate reciprocity into the way that we live.
Well said. Thank you.
John, hi.
Hi, Angela. I just want to follow on with the insurance. I get that Oregon will cover this. I'm assuming that Oregon will cover this under OHP, but it surprises me that anyone else in terms of commercial insurance would cover it in Oregon. I don't know where that stands. And I'm also wondering if there's any discussion at all about, and following on what Allison was talking about, pricing structure wherein, I mean, I know this has happened in municipalities throughout Oregon where, to use housing as an example, a certain percentage of housing in multi-unit housing. If you put aside 20% of your housing, you'll get a certain tax break, whatever. Are there any discussions of building in that kind of equity in terms of economic parity for people who can't afford it?
So the taxes piece is a little difficult because at least partially they're federal and they're not going to give any tax breaks for psilocybin, but state taxes, it is a very good question and a good thought. And I mean, we'd have to do some legwork to bring that piece of the conversation to the people who could make those decisions. Those are not decisions that we can make on the board. We can recommend perhaps, but the Oregon Psilocybin Services is limited in what they can make other organizations in the state do. So, go ahead.
I guess I was using that as an example in terms of what municipalities have done with trying to create more equity in terms of housing costs. That was just an example. I'm just wondering if there's been real discussion in terms of building in some sort of pricing structure that would allow for inclusion of people who can't afford it on the levels that we're really talking about here, which is, well, I'm looking at thousands of dollars for a session. So.
Right. So are you thinking more along the lines of, if this facilitator were to say offer one free session per 10 sessions, they could get some sort of discounted situation? Or are you speaking more of?
I'm speaking more of actually, and this is a real issue in terms of you're going to be increasing the cost for the people who can actually afford it.
Yes.
But you're actually including people who can't afford it, and they're the people who need it the most, to be right up front about it.
Mm-hmm.
Yes, it sort of boosts the overall costs. And again, it gets back to my question about insurance. OHP is one thing, and that covers a level of people who would never be able to afford it anyway.
Right.
Than the other insurances. But has there been discussion about a structure wherein 5% of your people are going to be pro bono, or 5% of your people are going to be 50% off, or whatever, just built into it, just going into it? That's my question, I guess.
I would say that in the equity subcommittee, we have started to broach that discussion. I think there's still a lot of discussion left to be had there. But there are, as far as I know, beyond the social equity plan, which, people could build that particular thing into, I will offset costs for 10 people and charge the other 40 folks a higher rate so that these 10 people can have services. That could be an option with the social equity plan. But as far as setting, we have not even started to touch on the topic of pricing really at this point. I know that we have to do that. We have to make some determination of like, how much is this all going to cost? Otherwise, we'll have kind of a wild set of options available to people. And it's a really hard thing to set. Like, how do you set the price of facilitation? I think we as the board can give some ideas for that, and OHA might be able to set some standards, but again, it is a free market and people will be able to set whatever prices they want. And if they have a product that people like enough, people will pay the higher price. That is a discussion that really does still need to happen. To the extent that we are able to control those prices, I think most of the price control that we have control over is going to be around how much is charged for licenses and how much is charged to, for instance, evaluate the products. Like, if a product needs to go through testing for psilocybin amount and contaminants and all of these other pieces, that will add the cost, that'll bring the cost up quite a bit. And for products that are more highly processed, the price is going to be higher because there will have to be a decent amount of lab work. There's also capping the actual product manufacturer itself. If we have a huge amount of product in the state, that brings prices down. If we have a very limited amount, that often brings prices up. So I know that the state does have a cap set on the amount of product that can be created in a given time frame. I don't remember if that has even been set, but I know that there is going to be a cap. And there actually has been some discussion of the possibility of, okay, what if we have a set cap of like no more than 500 pounds of psilocybin a year grown in the state, and people grow 1,000 pounds? What do we do with that? Does that just have to be destroyed? Which I know has been a concern for a lot of folks. Why would you want to destroy something? First of all, it's a living creature that doesn't deserve to be destroyed, and also that could be used for folks and maybe given freely to folks who are low income and have a need. So there's still some discussion there that needs to be done, and I don't know exactly where that's going to get in the next couple of months. The economic focus is really important to me. I was on Medicaid for like 15, 20 years. I would not have access to this program if I were still on Medicaid. I would not have access. I happen to be in a position of privilege now because I work for the state. But 3 years ago, there's no way. And so I really do hear and also feel the urge to make sure that this is going to be something that is accessible to folks. And I'm still not sure exactly how we're going to work that out.
Thank you for that. Very quickly, where does it stand with insurance? I mean, OHP is one thing, and I get that will probably be covered because it is OHP. Other insurance, where does it? I'm completely, because it is illegal federally, and this is a completely new thing in Oregon. Who's going to cover it?
Using people who are dual licensed as peer support specialists and facilitators. Peer support specialists cannot bill themselves, but if they are supervised by a licensed provider who is able to bill, the typical billing is 18 to 20 per 15-minute increment. They bill in 15-minute increments for peer support. So that adds up to be about $80 an hour that could be billed to insurance. Now, getting OHP to cover facilitation is another story altogether. Like right now, we can get peer support covered by people who are licensed peer support specialists, peer wellness specialists, doulas, what have you, people who are trained and certified, I think, by the Office of Equity and Inclusion to be a peer. They can bill for their services if they have a supervising provider who basically bills for them, says this person who is supervised by me and is a peer did these services. But if, this is going to be a topic of discussion probably for Medicaid, if people are billing for those services and they happen to be facilitating a psilocybin sit at the same time, there are currently no regulations that would not allow that, as far as I know. But there may be at some point. I really want this to be a possibility, especially in the context of Measure 109 and Measure 110 potentially being married at some point, and people who are peer addiction support specialists being able to offer services to people who are struggling with substance use and want to get the support and assistance from psilocybin to work through that and do some healing around it. The research is small around substance use concerns and psilocybin, but it's effective. in a lot of ways. We've seen it in multiple trials for multiple substances. It's not about like a rewiring necessarily of brain chemistry. It's about relationship. It's about creating relationship and healing, and then, reduce the trauma. You reduce the urge to use substances to cope with that trauma. And so that's, again, a pipe dream that I would love to have as an option in the future. But another piece of this is that a lot of Medicaid funds are federal funds. Not all, but a lot, which, federal funds are not going to cover psilocybin services. That's just not going to happen right now. But there may be a way to work it out in a way that the dollars do not come from the federal government. And, at least in my pipe dream, again, with Measure 110, we are using cannabis tax funds to grant money to organizations across the state that are providing peer support services. And that would allow those peers to be paid for their work and would be using cannabis funds, which are not federal dollars, to pay for those services. So that's sort of one potential loophole that could be used. But again, Measure 110 is a council-led process, and the council would have to agree to that option. And so, I have all of my pipe dreams, but they are the deciding body, and I very much support them in that. And it's a topic that I would love to bring to them at some point. Now is not the time because we are in a flurry of granting right now. So my thought is that will probably be a discussion that will happen later, and like maybe in a year or two, as both programs start to reach maturity and get a little bit more on their feet. At that point, we could start to discuss that as an option. But in the meantime, we can talk to Medicaid folks and say, hey, this is a service that could be really beneficial. Here are the studies. Here is the research. Here are the voices saying this has been so effective for me. Getting things like that covered would require a process of speaking to the HERC, which is the Health Evidence Review Committee. They make all of the decisions about what Medicaid will cover. And, right now Medicaid will cover peer support for sure. But adding in that extra piece of the psilocybin involvement might be, there's peer support from a harm reduction perspective, as in I walked into the room, you've already taken the psilocybin, I sat with you and supported you through something as a peer, versus peer support as in we had a discussion beforehand about your psilocybin use, and then I did an intake with you, and then the service center gave it to you and I was present. All of these different pieces that may alter the way that Medicaid would perceive the situation. There's harm reduction, as in I helped you out of a harmful situation, and then there is we both walked into this situation together, and knowing what was going to happen, acknowledging that you were going to take psilocybin, and so those details may play a part in how it all rolls out. Still don't know, still very amorphous in where we're going to be with that, still very much a dream, but working towards it.
And yes, and then there's preemptory harm reduction. So thank you very much. What you're doing is incredible. Again, thanks for all you do. I'm going to pass it over to Peter now as we're waiting patiently. Thanks.
Hi, Peter.
Hi, thank you so much for all the time and energy, and I really appreciate every time I hear you speak the passion and the dedication that you have for helping people and helping the most people possible. I was hoping you could run through what happens next. So we've got public comments until I think the 22nd,
Yes.
and then OHA actually makes rules. Oh, and then there's going to be more public comments later about the actual facilitation and licensing stuff. And like, so what's happening for the rest of the year?
The rules making process for OHA has a lot of different layers. With the first set of rules that are going through, we've gotten through the majority of those layers. They have been written, they have been through a rules advisory committee process, they've been through half of the public comment period. There's also, with public comment, the legislative comment period. So, legislators can weigh in on the rules. And then once all that is done and all the comments are integrated appropriately, they would then go into effect. I don't know. I think we're staging the rules. So, part of chapter, I think it's 333. 333 is public health. And then psilocybin got 333 for our little section of the rules. So chapter 333 is going to be additive, I believe. So we'll have rules about licensing, rules about training. So the rules will take effect, and those rules will govern the training process. So then we will be beginning the certification of the training programs that come forward and say, I want to train people. So then once those schools are certified, they can then begin enrolling students. So students will be able to enroll in programs starting this year. Different programs are in a variety of different places right now. Some folks are ready to roll right now. As soon as they get certified, like as soon as they're allowed to get certified, they will get certified and they'll start training students. And then those students will graduate and be eligible at the beginning of 2023 for licensure. And then once those folks are licensed, the licensing process for the facilities will start probably late this year. So the service centers will be beginning to be up and running in the beginning of 2023 as well. And then, of course, if you're going to be doing facilitation, you need products. So those rules will also take effect and govern the way that psilocybin is grown and manufactured in the state. And it doesn't take very long to turn over a crop of mushrooms. I think there may be a little bit of a hitch because licensing doesn't start. Certification of the schools will start, but licensing doesn't start until 2023. And I believe that is for all licenses. Yes, additional rules will be reviewed by rules advisory committees in September. All rules adopted by December 31st. So, there will be no rules to govern licensure of grow operations. Potentially, I may be wrong. Please correct me, anybody, if you know differently. But I think that the rules for licensing grow operations will be happening at the same time as facilitators license and the service centers license. So there may be a period in the beginning where we're just like, okay, when can we start? There are no mushrooms yet, but products should become available relatively soon. I know that there will be organizations again that are ready to hit the ground running. So products should be available soon after. So licensing will get going in the beginning of 2023, and then we'll have a little bit of a waiting period, and then the services will actually begin. So that's my best description of what the rest of the year should be like. One more piece is that the subcommittees, we have licensing, products, equity, training, and research at this point, and all except for equity are going to go quiet for the next little while. in part because we are done providing recommendations and the rules process needs to move forward, and also in part because of capacity. OHA really needs to just dive in and focus on rules and creating policies and structure for how this program is going to operate. So we'll still have our monthly psilocybin board meetings, but equity will be once a month, and all of the rest of the subcommittees, save the research, is going to go through maybe June, but then that will also go quiet. So it will just be equity continuing through the rest of the year monthly.
Well, we've pretty much wrapped up all of the time. I will remind people, I just put in the chat the links to fill out the feedback survey to let us know what you liked and any comments, and make a donation. We are a 501c3 and we need your dollars and your change. I suppose mostly, I think $1 is the low.
Support Portland Psychedelic Society.
And yeah, and if you're interested in volunteering, the link is in for that.